Chapter 32, Toddler and Family, everyone there? So I'm starting on page 843 under gross and fine motor development. Gross and fine motor development. You guys there? Okay. The toddler and family gross and fine motor development. By 12 to 13 months old, toddlers walk alone using a wide stance for extra balance so they don't fall over. And by 18 months old, they try to run, but they fall easily. At 2 years old, toddlers can walk up and down stairs. You need to know that. By 2.5 years old, they can jump using both feet. You need to know that. Stand on one foot for a second or two and manage a few steps on tiptoe. Next paragraph down. This has been seen on NCLEX. Make sure you know it. By 18 months old, toddlers can throw a ball overhand without losing their balance. By 18 months old, toddlers can throw a ball overhand without losing their balance. Next column under developing a sense of autonomy, Erickson. This is the stage, guys, that's autonomy versus shame and doubt. What's autonomy? When you can make decisions for yourself, right? So this is the age where they want to do everything by themselves, where you try to help them and they're like, no, they want to try to do it by themselves. Here's the thing. If you don't allow them to try to do things by themselves, they will doubt their abilities. But at the same time, you have to have a good balance, because if you allow them to do everything or try to do everything by themselves, you know they're going to fail. And if they fail a lot, they'll start to feel ashamed and not want to try anymore. So you have to have a balance, okay? So with the toddler stage, this is the stage you're in, autonomy versus shame and doubt. Autonomy, trying to do things on their own. And if they don't have a good balance of that, they'll develop what? Shame and doubt, okay? According to Erickson, the developmental task of toddlerhood is acquiring a sense of autonomy while overcoming a sense of doubt and shame. Next paragraph down. Just as infants have social modalities of grasping and biting, toddlers have the newly gained modality of holding on and letting go. Holding on and letting go are evident in how the toddler uses their hands, mouth, eyes, and eventually the sphincters when toilet training is begun. So this is a huge milestone for the toddler: toilet training, potty training. Children constantly express these social modalities in play activities such as throwing objects. So they have the ball in their hand and they learn how to let that ball go. Taking objects out of boxes, drawers, cabinets, holding on more tightly when someone says no, don't touch, and refusing to eat certain foods as their taste preferences become strong. Several characteristics, especially negativism and ritualism, are typical of toddlers in their quest for autonomy. So you will see this especially in the toddlers. The negativism is when they say no to everything, even if they mean yes. So you offer them a piece of cake. They want their cake, but they still say no. Why are they saying no? They're practicing their autonomy, being able to make decisions for themselves. They'll say no, and then they'll grab that piece of cake, right? And ritualism. Oh my gosh. Toddlers, and if you ever go to a preschool, you'll see with the toddlers, they have breakfast at the same time. They have nap time at the same time. They have a recess at the same time, because they thrive on those rituals. And that's why toddlers will be so picky. They will love waffles with syrup every morning. Then let's say you're giving them Eggo waffles and you always put the syrup in each little square. God forbid one morning you just put the syrup like zigzag. They'll freak out. Why? Because the toddler is especially into ritualism. They like things a certain way, the same way every single time, or they'll reject what it is that you offer them. So you need to know that. They love routine. Excuse me. The words no or me do can be their sole vocabulary. Emotions become strongly expressed, usually in rapid mood swings. They will go from laughing to crying in 2 seconds. They'll be so happy and then they'll cry because the sky is blue instead of purple. That's just a toddler, okay? So you guys need to know that. or they'll start crying because it's nighttime and you can't make it daytime for them. Next page. Under, you see where it says cognitive development, the sensorimotor and preoperational phase? Go over to that second column. The paragraph that starts with the discovery of objects as objects. Everyone see that? The discovery of objects as objects leads to awareness of their spatial relationships. Children can recognize different shapes, different shapes in their relationships to each other. For example, they can fit slightly smaller boxes into other, that's known as nesting, and can place round objects into a hole even if the board is turned around, upside down, or reversed. This is where they really start to learn those shapes. How many times have we seen object permanence? You know that's going to be on your quiz. Make sure you guys know it. Object permanence. Object permanence has advanced. Remember, this is when they realize that an object still exists, even if it's hidden, right? Although they still cannot find an object that has been invisibly displaced and is no longer visible or moved from under one pillow to another without their seeing the, where am I? Thank you, without the change, toddlers are increasingly aware of the existence of objects behind closed doors, drawers, and under tables. So very often what I'll see, the way that this will show up on an NCLEX question, if you get it on NCLEX, they'll give you the age group. Remember, toddlers are from 1 to 3. So we have the infancy, birth to 1, toddlers 1 to 3, then at 4 starts preschool. So they'll give you a toddler. And they'll give you an example of either medication or chemical or cleaning solution. And you're supposed to understand that it's not enough to have that medication or the chemical behind the cabinet, because they still know that it exists and they can still look for it. You have to have it what? Locked. Locked. Out of reach, but they can still climb, so locked, okay? Parents are usually acutely aware of this developmental achievement and find high places and locked cabinets, the only places that are inaccessible to toddlers. Next page. Pre-operational thinking. Pre-operational thinking implies that children cannot think in terms of operations. The ability to manipulate objects in relation to each other in a logical fashion. Rather, toddlers think primarily based on their perception of an event. And remember, guys, these toddlers are egocentric. So their perception is always going to revolve around them because they are very egocentric. Take a look at box 32.1. Make sure you know these terms and what they are. Egocentrism. Everything's about them. At the toddler's age, if they do something wrong, let's say they hit another child, they hit another patient, you cannot say to that toddler, how do you think little Bobby felt when you hit him? Because they don't have the capacity to think about anyone but themselves. They are very egocentric, okay? Implication. Avoid moralizing about why. At this age, they're more about rules. Do this, don't do that. They don't care about the why yet. You want to avoid that. You want to focus more on the rules. Global organization. Reasoning that changing any one part of the whole changes the entire whole. Perfect example. You know they're picky eaters, right? You give them their favorite food. But if there's one piece of food that is on the same plate with their favorite food, they will reject that entire plate because of that one thing. Animism. Attributing lifelike qualities to inanimate objects. That's been seen on NCLEX very often. Make sure you know it. Magical thinking. Also been seen on NCLEX often. You need to know that the toddlers have magical thinking. They believe that their thoughts can make things happen. So if mommy or daddy got in a car accident, they will feel guilty because maybe they got punished right before the car accident. You know, toddlers, they'll be like, I hate them, I hope they die. And then they get in a car accident, they'll think it's their fault. So as a nurse, you have to let that toddler know that this is not your fault. You did not cause this to happen, because that's what they're going to think. They have magical thinking. Implication. Clarify that thoughts do not make things happen and the child is not responsible. Inability to conserve. Inability to understand the idea that a mass can be changed in size, shape, volume, or length without losing or adding to the original mass. So you'll have a gallon of water in a very long tube, and then you have that same gallon of water in a short tube, but what's the word when it's this way? Wide, thank you. They don't understand, so they'll think the taller one is more than the wider one. They don't have that understanding, so that's that inability to conserve. Next page, under development of body image. Development of body image. With increasing motor ability, toddlers recognize the usefulness of body parts and gradually learn their respective names. Let me stop here for a moment, because it's important that you address body parts with their anatomical names, so you don't call the vagina cookie, right?
My friend's parent did that.
You don't do that, because if the child's being abused, they won't even be able to verbalize what's happening. By 2 years old, toddlers recognize general differences and refer to themselves by name and then by pronoun. Gender identity is developed by 3 years old. Let's skip a paragraph, go to the paragraph under the one we skipped. It is evident, everyone there? It is evident that body integrity is poorly understood and that intrusive experiences are threatening. Let me stop right there. With the toddler, they are terrified of anything intrusive. And the reason for that, for example, if they have to get a shot, they literally think, if they bleed, they think that their insides are going to come out of that hole where they're bleeding. So they are terrified of anything that's intrusive. Even let's say you just want to check the ear. Because something's going into the ear, they're terrified, okay? You need to know that. For example, toddlers forcefully resist procedures such as examining their ears or mouth and having their axillary temperatures taken. The procedure itself, such as taking vital signs, does not hurt the child, but it represents an intrusion into the child's personal space, which elicits a strong protest. So a couple things. Number one, allow the child to sit on their parents' lap when you're assessing them. That's going to make your life easier, and it's going to bring comfort and a sense of security to the child. That's number one. Number two, always start with the least invasive. So you have to do a physical assessment on the child. Look at them first. Look at their breathing. You can listen to the heart and the lungs before you stick anything in their ear or their mouth or their nose with a light, okay? So you're gonna go from least invasive to most invasive and perform the assessment while they are on the parent's lap. Development of gender identity. Everyone there? Just as toddlers explore their environment, they also explore their bodies and find that touching certain body parts is pleasurable. Other demonstrations, a couple lines down, maybe 4 or 5 lines down. Other demonstrations of pleasurable activities include rocking, swinging, hugging people and toys. Parental reactions to toddlers' behaviors influences the child's own attitudes and should be accepting rather than critical. So what you want to teach them, if they're touching themselves in public, you just tell the child, we don't do that in public, but you don't tell them, ew, that's nasty, because you're going to give them a negative sense of self. Oh, sorry. Does that make sense? No, it's not Matthew. All right, language development. No, I'm lying, not language development, social development. Let's talk about social development first. The second to last paragraph under social development, where it says transitional objects. Everyone see it? Transitional objects such as a favorite blanket or toy that's been seen on NCLEX, make sure you know it. Favorite blanket or toy provides security for children, especially when they're separated from their parents, dealing with a new stress, or just fatigue. So if it's a child that's being hospitalized, you're going to encourage the parents to bring something familiar from home, their favorite teddy bear, their favorite blanket. Such behavior is normal. Very often you may see that the child regresses, and whenever the child is stressed, it could be a physical stress such as illness or just being in the hospital, or maybe they have a new sibling and they don't like all the attention that a new sibling is getting. They'll tend to regress as normal behavior. There's no need to, they're still talking about the security object, so let me talk to you about that. You have to teach your parents, don't be annoyed about that child wanting the security blanket or insisting on the security blanket. It's normal. Anytime that they're stressed, they're going to want to have it. So you teach the parent that it's normal. During times of separation, such as daycare, hospitalization, or even staying overnight with a relative, transitional objects, such as something that is familiar to them, that gives them a sense of security from home, should be provided to minimize any fear or loneliness. You have to let the parents know, because you'd be surprised. Many parents think that their kid is a weirdo because they didn't want something that is familiar to them. All right, language development. Second paragraph under language development. At 1 year old, children use one-word sentences or hollow phrases. The word up can mean pick me up or look up there, look up here. By 2 years old, children use multi-word sentences by stringing together 2 or 3 words, such as the phrases mama go bye-bye or all gone. Next page, under play. So, remember last week when we talked about the infant? The infant had solitary play. They played by themselves, right? Now we're talking about the toddler. And the toddler has parallel play. So parallel play, this is when toddlers play alongside, not with other children. So you'll have 2 toddlers playing with a truck each, but they're not playing together. They're each playing with their truck side by side. Make sure you know that. The toddler inspects toys, talks to toys, tests toy strength and durability, and invents several uses for toys. Imitation is one of the most distinguishing characteristics of play and enriches children's opportunity to engage in fantasy. Next paragraph down, increase locomotive skills. Everyone see it? Increased locomotive skills make push-pull toys. If I had a penny, but every time push-pull toys is showing up on NCLEX, I'd be a rich woman. Make sure you know it. Push-pull toys, straddle trucks for cycles, small gym and slide, balls of various sizes, and riding toys appropriate for energetic toddlers. So you need to know the types of toys that are appropriate for the toddler versus the infant versus the preschooler. Finger paints, thick crayons, chalk, blackboard, paper, and puzzles with large, simple pieces use toddlers developmenting fine motor skills. About 5 lines down, parents and other providers are encouraged to allow children to play with a variety of toys that foster creative thinking, such as blocks, dolls, and clay, rather than passive toys that the child observes, such as a battery-operated or mechanical toy. Active playtime should be encouraged over the use of computer or video games. Toys should not be substituted for the attention of devoted caregivers, but toys can enhance these interactions. Take a look at table 32.1, growth and development during the toddler years. Go down to 24 months old, so the 2-year-old. Under language, the 2-year-old has a vocabulary of about 300 words, and they use 2 or 3 word phrases. Couple lines down. Also, the 2-year-old talks incessantly, and they don't even care if you're paying attention. They will talk and talk and talk. 30-month-old. Under fine motor, they build tower of 8 cubes. You see the nursing care guidelines assessing toilet training readiness. Make sure you guys read that on your own. Page 853, regression. This is when a child's behavior and mentally they go back to a younger time where they felt safe because there's been a change, there's been a stress to them. Everyone at regression? The retreat from one's present pattern of functioning to past levels of behavior is referred to as regression. They're regressing back to another time. It usually occurs in instances of discomfort or stress when one attempts to conserve psychic energy by reverting to patterns of behavior that were successful in earlier stages of development. Regression is common in toddlers because almost any additional stress hinders their ability to master present developmental tasks. Any threat to their autonomy can cause them to regress. If they're stuck in a hospital bed, they won't have much autonomy, right? Or if they're home stuck with the flu and they can't move. So anything that is a threat to their autonomy, that increases their risk for regression. Next column where it says ritualism. You guys see ritualism? Toddlers like to have the same dish, cup, or spoon every time they eat. They may reject a favorite food simply because it was served in a different dish. If one food touches another, they often refuse to eat it. Mixed foods such as stews or casseroles are rarely favorites. Because toddlers have unpredictable table manners, it's best to use plastic dishes and cups for both economic and safety reasons. They're still clumsy at that age and they'll throw things. Next page, dietary guidelines. Under dietary guidelines, look at the second to last paragraph where it starts with iron fortified cereals. Everyone see that? Okay. Iron fortified cereals and iron rich foods are recommended for all children older than 6 months of age. Because remember, around 5 months of age, that's when the maternal stores of the iron starts to be depleted. Parents should be encouraged to provide an iron-rich diet that includes hemi and non-hemi iron sources. You need to know these sources, guys. Red meat, poultry, fish, green leafy veggies, dried fruits, and beans, and limit whole milk consumption. So remember, once they turn 1, they start getting cow's milk. But we can't give them too much because remember, that milk decreases absorption of iron, okay? Calcium and vitamin D are essential for healthy bone development. We need the calcium for bone development and we need the vitamin D to absorb the calcium. Whole milk, cheese, yogurt, legumes, beans, and vegetables such as broccoli, collard greens, and kale are good sources of calcium. Popular calcium fortified foods include waffles, cereals, cereal bars, orange juice, and some white bread. Adequate vitamin D intake is essential to prevent rickets. It's not recommended that children and adolescents have an intake of at least 400 IU of vitamin D daily. Go about 5 lines down. Sources of vitamin D include fish, fish oils, and egg yolks. Fortified cereals, dairy products, and meat are also good sources of zinc and vitamin E. It's recommended that toddlers have 1 cup of fruit each day. Vitamin C enhances the iron absorption. Look at box 32.2 factors that affect iron absorption. First, let's talk about what increases iron absorption. Put a happy face next to that so you can remember that's a good thing. These are the foods you want to encourage because it increases iron absorption. Low acidity. I'm sorry, high acidity, low pH, sorry. You're gonna administer iron between meals. Iron is best given, guys, in the morning on an empty stomach. You got that? Okay. With orange juice, why? Because that ascorbic acid, that's what helps that patient to be able to absorb the iron. Meat, fish, poultry. Now let's look at what decreases iron absorption. We want to stay away from that. Alkalinity, high pH foods. The higher the pH, the more basic it is, and the lower the pH, the more acidic it is. Phosphates, such as milk. Oxalates, and they give you examples, plums, currants, green beans. And malabsorptive, disorders. Next page is sleep and activity. Second paragraph, 1, 2, 3, 4, 5, about 8 or 9 lines down. It says providing transitional objects such as a favorite stuffed animal or blanket can ease the child's insecurity at bedtime. You guys see that? Toddlers never want to go to sleep. They feel like they're going to miss out on something. They think as soon as they close their eyes, they're going to have a big party, they're going to miss out. And some toddlers, they're scared of going to sleep. They're scared of the dark, and they think when they close their eyes, they're in the dark. So for whatever reason, it increases anxiety for them. So you want to give them something that's going to make them feel secure, decrease their anxiety, such as a transitional object. Keep the television out of the child's room. Make the hour before bedtime a quiet time of reading stories. Avoid stimulating activities such as computer games and roughhousing right before sleep. Limit prolonged bedtime rituals by defining a length of time and set of activities, because they will keep saying one more story, or, oh, I have to use the bathroom again, or can I have another cup of water? They'll keep trying to delay bedtime.
What is roughhousing?
Oh, like when you play like wrestling, or play fighting. Next page, dietary factors. One, 2, 3, 4. Dietary factors. 5 paragraphs down, where it says early childhood caries. Everyone see that? Oh, maybe for the old edition, it might be dental care, but this edition says dietary factors on page 858. All right. Early childhood caries. Historically called nursing caries or baby bottle tooth decay. This often occurs when the child is routinely given a bottle of milk or juice at nap time or bedtime, or uses the bottle as a pacifier while awake. This is a huge no-no. You never let that child fall asleep with the bottle in their mouth, because the sugar that was in the juice, which they should not be giving that child juice anyway. If they give the child juice, it better be a real fruit juice and only a limited amount, but moving on. The sugar from that juice, or even from that milk, it just sits there, and so it can cause the tooth decay. The practice of coating pacifiers with honey can also contribute to caries and may be a potential source of botulism. So teach your parents not to do this. About 2 paragraphs down, prevention. Prevention involves eliminating the bedtime bottle completely, feeding the last bottle before bedtime, substituting a bottle of water for milk or juice, not using the bottle as a pacifier, and never coating the pacifier in sweet substances. All of this you need to teach your parents not to do. Juice in bottles, especially commercially available ready-to-use bottles, is discouraged. These beverages are especially damaging because the sugar is more readily converted to acid. Juice should always be offered in a cup to avoid prolonging the bottle feeding habit. So let me stop right there for a second. In infancy, birth to 1 year, they have the bottle, right? Then when they turn 1 year old, just like they go to the cow's milk, they go to a sippy cup. They shouldn't be using a bottle anymore. So as a nurse, if you see that child is a toddler and they're still using bottle, you have some teaching to do with the parents because they should have transitioned to the sippy cups. Toddlers should be encouraged to drink from a cup at the first birthday and wean from a bottle by 14 months. Table 32.2. Everyone there? Mm-hmm. Injury prevention during early childhood. So the first one is motor vehicles. Next one, drowning. Important things. I'm not going to go over all of them. I'm just going to highlight the most important ones. When it comes to drowning, never under any circumstance leave unsupervised in the tub. You have to teach that to the parents. Have fence around swimming pool and a locked gate. For burns, turn pot handles towards the stove because those toddlers, as they're running, they can just reach up and touch that pot handle. Whatever was on the pot will fall on the child. Place electrical appliances such as coffee maker, popcorn machine towards the back of the counter. Store matches and cigarette lighters in locked or inaccessible area. Discard carefully because children know how to go through trash. Do not let tablecloth hang within a child's reach because they're going to pull it and everything that was on the table is going to fall on them. Always check bath water temperature. Adjust water heater temperature to 49 degrees Celsius or lower. Do not allow children to play with faucets. Apply sunscreen when the child's exposed to sunlight all year round because guess what? Even when it's cloudy, those sun rays still go through the clouds, right? All right, accidental poisoning. Place all potentially toxic agents, including cosmetics, personal care items, cleaning products, pesticides, and medications out of reach and what? Locked. Very good. Caution against eating non-edible items such as plants. You'd be surprised how many children a year are poisoned by eating plants. Lots of plants are poisonous when ingested. They don't know that. They just eat it. They try it. When you give medications to a child, don't ever refer to it as candy. Never remove labels from containers or toxic substances because God forbid if that child ingests something, you need to know what they ingested when you call the poison control hotline. Know the number of the poison control hotline. For falls, use window guards. Place gates at the top and the bottom of stairs. Keep doors locked or use childproof doorknob. Remove scatter rugs. Keep the crib rails fully raised and the mattress at the lowest position so it'll be harder for them to climb out. For choking and suffocation. Suffocation, yep, choking and suffocation. Next page. Everyone there? Avoid large round chunks of meat, such as whole hot dogs. So what you're gonna do is slice those hot dogs because if the hot dog is round, it can get lodged in that child's throat and there's no way for them to be able to breathe. But if you cut them in like triangles or slices, even if it gets stuck in their throat, there's still a little bit of area for oxygen to still get through while you're trying to get that kid help, okay? Avoid fruit with pits, fish with bones, hard candy, chewing gum, nuts, popcorn, grapes, and marshmallows. This looks like a beautiful select all that applies to me. Choose large, sturdy toys. Why large? So they can't put it in their mouth and choke on it. Why sturdy? So a piece of the toy doesn't fall off, and that piece of the toy, they swallow it, or try to. Install smoke and carbon monoxide alarms. For bodily injury, avoid giving sharp or pointed objects. Do not allow lollipops or similar objects in the mouth when walking or running. Teach safety precautions, such as to carry knife or scissors with pointed end away from the face. Store all dangerous tools, garden equipment, and firearms in what type of cabinet? Locked. You guys are seeing common thread here? Teach stranger safety. Avoid personalized clothing in public places. Never go with a stranger. Tell parents if anyone makes them feel uncomfortable, etc. Make sure you guys look at that list. On the next page, under family-centered care, that box, using car restraints, make sure you guys read that on your own. If I ask you anything from this box, I'm gonna ask you, which way should that child's seat be facing? Frontwards or rear facing? Rear facing. Drowning. Page 862, drowning. Everyone there? Towards the end of that paragraph under drowning, close adult supervision of children when near any source of water is essential. Teaching swimming and water safety can be helpful, but this cannot be regarded as enough protection. Pool fencing, although critical, does not always deter fast-moving children. So you have to supervise them. And here's the thing with toddlers. Let me show you guys something. Remember, the toddler, their head is much bigger than the body. Their body hasn't caught up to their head yet. So they're running, and then they see the pool, and they know they're not supposed to get in the pool, so they stop. But remember, the head's bigger than the body. So even though they stop abruptly, what do you think happens? They fall right into the pool. Next page, that box on family-centered care guidance during the toddler years. Make sure you guys read that on your own. Box 32.8, selected poisoning in children. Let's look at acetaminophen. Everyone there? Box 32.3, selected poisonings in children. Box 32.3. Selected poisonings in children. Under acetaminophen, what medication is acetaminophen? Very good. Okay. Under comments for the acetaminophen, this is the most common accidental drug poisoning in children. Treatment, you do need to know the treatment. Antidote. And acetylcysteine, that's your mucomist, is equally effective given IV or orally. Next, aspirin. Look at the treatment for aspirin. It's on the next page. Activated charcoal is given as soon as possible. If bowel sounds are present, it may be repeated every 4 hours until charcoal appears in stool. You need to know the difference between the treatment for Tylenol versus aspirin. Page 867, poisoning. That box that says poisoning, emergency treatment. Everyone there? All right. Poisoning. This is number one. Everybody put a big old number one next to it so you don't forget. Assess the victim. Always. The first thing you have to do is find out if they're responsive or not. Okay? Assess the victim. Are they responsive? You're going to initiate cardiorespiratory support if needed. Remember, circulation first, their airway breathing, terminate exposure or whatever it was that causes poisoning, get it away from them. If it's in their mouth, get it out of their mouth. 3, identify the poison. And of course, because when you identify the poison, you're calling the poison control hotline. And the first thing they're going to ask you is what that child ingested, right? 4, prevent poison absorption. Now with number 4, where it says prevent poison absorption, look what it says. Place the child in a side-lying, sitting, or kneeling position with the head below the chest to prevent aspiration. Look at the nursing alert right next to that box. Syrup of Ipecac is no longer recommended, because it used to be. Is not recommended for routine poison treatment intervention in the home. So you let the parents know that. Right under that nursing alert, about 5 lines down, it says activated charcoal may be considered in the following situations. When do you expect activated charcoal to be given? Child may have ingested large amounts of carbamazepine, dapsone, phenobarbital, quinine, or theophylline. Time to activated charcoal administration is within 1 hour after ingestion of the poison. Child has intact or protected airway. Next paragraph down. You see where it says if the child is admitted? If the child is admitted to the ER, gastric lavage may be performed to empty the stomach of the toxic agent. However, this procedure can be associated with serious complications, such as GI perforation, and that is a medical emergency within itself. That patient has GI perforation, you know they're going to the OR. Hypoxia and aspiration. So we're going to be very careful. Next page. The paragraph right before it says prevention of recurrence, where it says antidotes available to treat ingestion. Everyone see that? Antidotes available to treat toxin ingestion include, and someone pronounce that for me. Acetylcysteine for naloxone, give me a second, I'm getting tongue-tied. Let me do this again. Antidotes available to treat toxin ingestion include N-acetylcysteine for acetaminophen poisoning, oxygen for carbon monoxide inhalation, naloxone for opioid overdose, flumazenil for benzodiazepine overdose, digoxin immunfab for digoxin toxicity, amyl nitrate for cyanide, and antivenin for certain poisonous bites. You guys need to know those antidotes. This box that says poison prevention is a box under this beautiful little girl. Make sure you guys read that box on your own. How to prevent poisonings. Next page, look at this nursing alert. Mercury thermometers are no longer recommended because if they're broken, the inhaled vapors can cause toxicity. You guys see lead poisoning? Look at that last line under lead poisoning. There are no safe blood levels in children. Anything higher than 5 needs to be reported to the state. Box 32.4, sources of lead. Number 1, lead-based paint in deteriorating condition. So these old homes that were built before, I think it was the 1950s, I don't recall, but the paint used lead, and so you have these toddlers that'll just peel the paint and then eat it. Next page, pathophysiology and clinical manifestation for lead poisoning. Everyone see that? Pathophysiology and clinical manifestation. Of most concern for young children is a developing brain and nervous system, which are more vulnerable than those of older children and adults. Lead ultimately settles in the bones and teeth, where it remains inert and in storage. Screening for lead poisoning. It's on the second column, bottom of the page. Screening for lead poisoning. Universal screening should be done at 1 and 2 years old. Everyone see that? Next page, therapeutic management. Education is one of the most important elements of the treatment process. Areas that the nurse needs to discuss with the family of every child who has an elevated, what's that BLL stand for? Blood lead level, more than 5, includes the following. Look at this list, guys. Teach them about the child's blood lead level and what it means, the potential adverse health effects of an elevated level, sources of lead exposure, the importance of good nutrition, need for follow-up testing, results of an environmental investigation, if applicable. And with that one, guys, the state will send a nurse into the patient's home and daycare, and they'll investigate to try to find out why this kid's lead level is so high. Where's it coming from? And the hazards of improper removal of lead paint. Chelation therapy. Do we pronounce that chelation or chelation? I swear if I had time, I'd get speech therapy. I just don't have the time. I don't want to say it. All right, chelation therapy. I say chelation is the term used for removing lead from circulating blood and theoretically some lead from organs and tissues. Take a look at table 32.3, blood lead levels and recommended action. Less than 5, you're going to provide education, the education that we just talked about. More than 5, it has to be reported to the state. Next page, reducing blood lead levels. You see that box, guys? Everyone there? Make sure children do not have access to peeling paint. Remember, that's the #1 source. Peeling paint or chewable surface paint with lead-based paint. The next one, if a house was built before 1978, what did I say, 1950s? I lied, so 70s. Before 1978, and has hard surface floors, wet mop them at least once a week, wipe other hard surfaces. Do not vacuum hard surface floors or windowsills or wells because it can spread the dust. Wash and dry the children's hands and faces frequently. Wash toys and pacifiers frequently. Another source that is a very high source, I didn't see it on the list, or maybe it was on the list, I don't remember, but toys, a lot of the toys that come from a particular country are high in lead. And so the children, what do? They like putting toys in their mouth. And so that can cause them to have lead poisoning as well. Oh, it's in this box?
Yeah, it's on the second.
Okay, great. Use only cold water for consumption. Hot water dissolves lead more quickly. Do not store food in open cans, especially if they're imported. Avoid folk remedies or cosmetics that contain lead. Avoid candy imported from Mexico. Oh, I can see my comments right now, geez. Avoid imported toys, thank you, and jewelry that may contain lead. And the last one, consider iron supplementation if child does not regularly consume foods high in iron. Because with that high level, that patient's, they're going to be anemic. The iron level is going to be low. All right, guys, take a 10-minute break, and then we're going to do chapter 33. I know, it's so much. Okay, biologic development. Third paragraph, that first line, it says physical proportions no longer resemble those of the squat, pot-bellied toddler. Let's go to gross and fine motor skills. At 3 years old, preschoolers can ride a tricycle. Underline that, highlight it, put it, star next to it. If I had a penny for as many times as that showed up on NCLEX, I'd be a rich woman as well. NCLEX, ATI, HESI, you name it. I don't know why they like to ask about the tricycle, but they do. 3 years old, 3 wheels. Don't forget it. Walk on tiptoe, balance on one foot for a few seconds, do broad jumps. By 4 years old, children can skip and hop proficiently on one foot and catch a ball reliably. By 5 years old, children can skip on alternate feet and jump rope and begin to skate and swim. Psychosocial development. For Erickson, this is the stage of initiative. Maybe about 8 lines down, it says conflict arises when children overstep the limits of their ability and inquiry and experience a sense of guilt for not having behaved appropriately. This is the age of people pleasers. Next page, pre-operational phase. Piaget. Language. Speech remains primarily a vehicle of egocentric communication. So everything they're going to communicate is going to be about them. Preschoolers assume that everyone thinks as they do, and that brief explanation of their thinking makes the entire thought understood by others. Third paragraph down, superficially, causality resembles logical thought. So here's an example of causality. An example is the concept of time. Because time is incompletely understood, the child interprets it according to his or her own frame of reference, such as a long time means until Christmas. Consequently, time is best explained in relationship to an event such as your mother will visit you after you finish your lunch. This is a wonderful example because when it comes to the preschoolers, it's not a good idea to, when you're talking about time, to say 3 o'clock or 4 o'clock because they won't understand what that means. You have to, when you're talking about time, it has to be in relation to something that they understand, that they see very often. So it might be something like you'll get to play after this cartoon is over. If the cartoon just started, then cartoons are usually about 30 minutes, so it'll be 30 minutes. But you can't say 30 minutes to the preschooler because that means nothing to them. Avoid words such as yesterday, tomorrow, next week, or Tuesday to express an event that is expected to occur. And instead associating time with expected daily events. This helps children learn about temporal relationships while increasing their trust in others' predictions. Put a star next to this. Preschoolers' thinking is often described as magical thinking. Because of their egocentrism and transducive reasoning, they believe that their thoughts are all powerful. Nursing alert. Because of magical thinking, the child may believe that he or she wished the other parent away. The child should be reassured that this is not the case. Never call a child bad, because to them, that means that they are a bad person. What you may want to say to that child is, that was a bad thing to do, but the child themselves is not bad. They are not a bad person. Something else I want to bring to your attention in that nursing alert about never calling a child bad, but letting them know that the behavior was bad. They see good and bad in terms of reward and punishment. So you're good, you're going to be rewarded. You're bad, you're going to be punished. Development of body image, next page. Towards the end of that first paragraph. Because these are formative years for both boys and girls, Parents should instill positive principles of body image, give their children encouraging feedback regarding their appearance, and emphasize the importance of accepting individuals no matter their difference of appearance. Well, you guys know it's not a good idea to call a child fat, right? Or to take a snack from them telling them that you're taking the snack so they don't become fat. Next paragraph, 3 lines down. Intrusive experiences are frightening. Remember, anything that is intrusive, they're going to be scared of, especially those that disrupt the integrity of skin, such as injections and surgery. They fear that if their skin is quote unquote broken, all of their blood and their insides can leak out. Therefore, bandages are critical to keep everything from coming out. That's why bandages are so important to the preschoolers. The bandages keep their insides in. Development of sexuality, second paragraph down. Sex role imitation and dressing up like mommy and daddy are important activities for the preschooler. Language. The middle of the first paragraph. Vocabulary increases dramatically from 300 words at 2 years old to more than 2,100 words at the end of 5 years of age. Next paragraph. Children between 3 and 4 years old form sentences about 3 or 4 words and include only the most essential words to convey the meaning. They talk incessantly regardless of whether anyone's listening or answering them. They enjoy musical and talking toys or dolls, and they imitate new words proficiently. Next page, very first sentence. From 4 to 5 years old, the preschoolers use longer sentences of 4 or 5 words and use more words to convey a message, such as prepositions, adjectives, and a variety of verbs. They follow simple directional commands, such as put the ball on the chair, but can only carry out one request at a time. So you need to give those requests one at a time. You can't say, I want you to put the ball in the chair, then take that chair and put it in the corner and then close the door. You can't, they can't follow that. You have to give them the directions one at a time. Go down to play. Put a star next to this. Remember, I told you, you have to know the differences of play. Infancy versus toddler versus preschool. The preschool's play is associative play. They're finally playing with each other. Associative play, group play in similar or identical activities. Look at this, but without rigid organizational rules. So they're playing together, but it's just play. There are no rules. They're not stuck on rules yet, but they soon will be.
Where was that?
Under play?
Yeah.
Above the picture of the boys, like it's 2.
You see that? All right, skip a paragraph where it says easy construction sets, blocks of various sizes and shapes, counting frame, alphabet, number, flashcards, paints, crayons, simple carpentry tools, musical toys, illustrated books, simple sewing or handicraft sets, large puzzles, and clay are suitable toys. They have imitative, imaginative, and dramatic play. Dress-up clothes, dolls, housekeeping toys, doll houses, play store toys, telephone phones, farm animals and equipment, village sets, trains, trucks, cars, planes, hand puppets, and medical kits provide hours of self-expression. Now, a couple lines right above the picture of the little boy next to the, what's that thing called? Fire hydrant? Okay. Parents need to be aware of the potential positive and negative effects of media exposure. Parents and other caregivers should supervise the selection of programs and applications, co-view and discuss programs with their children, play games with their children, limit media exposure to 1 hour a day for children 2 to 5 years of age, and set a good example of media use. So you can't just limit them to 1 hour and you're on that phone, on those apps all day. Next paragraph. The appearance of imaginary companions usually occurred between 2.5 and 3 years old. And for the most part, such playmates are relinquished when the child enters school. And the reason for that is because their mind's now occupied. There's no need for that imaginary friend. The paragraph after that one, no, not the next one, but skip a paragraph. Go to where it says parents often worry. You guys see that? Mm-hmm. Parents often worry about imaginary playmates, not realizing how normal and useful they are. Parents need to be reassured that the child's fantasy is a sign of health that helps differentiate make-believe and reality. Parents can acknowledge the presence of the imaginary companion by calling him or her by name and even agreeing to simple requests, such as setting an extra place at the table. Look at this, guys. But they should not allow the child to use the playmate to avoid punishment or responsibility. So they break something, you can't allow them to say that the playmate, that the imaginary friend broke it. Okay? Table 33.1, growth and development during preschool years. For the 3-year-old, under gross motor, ride tricycle, put a star next to that. The 3-year-old, they can ride a tricycle. So next to 3, under gross motor, you should see rides tricycle. It's a table. Under fine motor, they build tower of 9 to 10 cubes. And in drawing, they copy circle, highlight the circle, put a star next to the circle. They ask about this a lot. They imitate, it imitates cross. Language, use complete sentences of 3 or 4 words. They talk incessantly, regardless of whether people are listening or not, and they ask many questions. We're still on the 3-year-old. Socialization, dress itself almost completely, may have fears, especially of the dark and going to bed. They know their gender and the gender of others. Highlight this, put a star next to it. Play is what? Parallel. Play is parallel and associative, because remember, they're just coming off of the toddler, okay? So it's parallel and associative. They begin to learn simple games, but often follows own rules. There's no rule for the game itself. Does that make sense? Under cognition, the 3-year-old has beginning ability to view concepts from another perspective, just a little bit. They're still egocentric, but they're starting to be able to view concepts from another point of view. Family relationship, they attempt to please parents and conform to their expectations. They want to be a good boy or a good girl. All right, 4-year-old. For the 4-year-old, under gross motor, they skip and hop on one foot. They throw a ball overhead. For fine motor, they use scissors successfully to cut out picture. In drawing, they copy squares. For language, they know simple songs. For socialization, they tend to be selfish and impatient. They take pride in accomplishments. Play is what? Associative. For cognition, and remember guys, cognition is how you think, right? For cognition, they obey because parents have set limits, not because of understanding of right or wrong. They do it because that's the rule. For family relationship, do's and don'ts become important. They are rule followers, people pleasers. For the 5-year-old, for gross motor, they skip and hop on alternate feet. For fine motor, they can tie their shoelaces. Under language, the 5-year-old uses sentences of 6 to 8 words with all parts of speech. They know the days of the weeks, the months, and other time-associated words. Under socialization, the 5-year-old's independent but trustworthy, not foolhardy, more responsible. Why? Because they're more about following the rules. They want to please you. They're eager to do things right and to please. They try to live by the rules. They have better manners. And for family relationship, the 5-year-old strongly identifies with the parent of the same sex, especially boys with their fathers. Next page, sex education. Everyone there, sex education? About 4 lines down, the word why seems to supplant the word no, which was common in toddlerhood. Because remember the toddler, what's that word where they love to say no to you?
Yeah.
Starts with an N.
No.
What is negativism? Yes. So they went from negativism in toddlerhood where everything was no, even if they meant yes, they were saying no to you, right? We go from no to why. So you tell them to do something when they were a toddler, they just say no, but now they want to know why. 2 rules govern answering sensitive questions about topics such as sex. The first is to find out what children know and think. And guys, this goes across the board. We talked about this in farm. You know that before you do teaching, the first thing you're going to do is find out how much that person knows. What if you plan on doing teaching starting down here, and then you realize they know this much? You would have looked like a fool. Or you plan on starting your teaching here, and then you found out they only knew this much. So the first thing you need to do is find out what this preschooler knows. Okay, so that's going to be number 1. Find out what they know and what they think. Next paragraph, the second rule for giving information is to be honest. And they're preschoolers, so you do not have to go into minute detail, but you do have to be honest. 2 paragraphs down. Many children are still unaware of the reproductive function of the genitalia. Their curiosity is for eliminative function of the anatomy. Doctor plays often a game invented for such investigation. Little girls are no less curious about boys' anatomy. It is intriguing to closely inspect this quote unquote thing that girls do not have. So it's just a natural curiosity that they have for the body parts. Next page, under promoting optimal health during preschool years. Everyone see that? Promoting optimal health during preschool years. Just write down that they're picky eaters. You need to remember that they are picky eaters. Because that big old paragraph, all of that is just to tell you that they're picky eaters, okay? Let's go a paragraph down where it says American Academy of Pediatrics Committee on Nutrition. They recommend that the total fat intake, average over several days, be reduced to 30% of the total caloric intake for children 2 years old and older. This recommendation is important in prevention of childhood obesity and development of other morbidities. We're seeing childhood obesity and we're seeing type 2 diabetes in children much more often than we did 10, 15, 20 years ago. 2 paragraphs after that, next page where it says milk and dairy products, it's right next to the picture of the woman with the 2 children. You guys see that? Milk and dairy products are excellent sources of calcium. Low-fat and non-fat milk may be substituted for higher fat choices so that the quantity of milk may remain the same while limiting fat intake overall. And this is a change because remember, during the toddler, when that child turned 1 to about 3 years old, they needed that fat in the cow's milk for the growth, right? Okay. Excessive consumption of fruit juices and sugar-sweetened beverages has been associated with dental caries, obesity, and adverse cardiometabolic effects. Look at the nursing alert below. It says obesity in young children has increased significantly over the past 3 decades, so efforts to provide a healthy diet and to encourage physical activity should begin early to help children achieve optimal health. Now, right under this photo with the woman and her 2 children, that paragraph right below it, take a look at this. The amount and variety of foods consumed by young children vary greatly from day to day. Consequently, parents sometimes worry about the quantity and quality of food that preschoolers consume. In general, the quality is much more important than the quantity, a fact that should be stressed during nutritional counseling. Sleep and activity. An appropriate and consistent bedtime, nap schedule as needed, and bedtime routine can help prevent and treat common sleep problems and night wakings experienced by young children. So it goes back to all of those things you're going to teach the parents, such as, have a routine for them when they're going to sleep, because if they have a routine, their body, as soon as it's 8 or 8:30, their body's naturally going to start to unwind if they have that routine. Make sure that they're not watching TV, watching cartoons, they're not on the iPad an hour before it's time to go to bed, because their brain needs to shut down, right? It needs to start shutting down. No roughhousing. You want to make sure that you have a nice dimly lit environment, maybe quiet, soft music. You want to have a ritual such as reading a story to them before bed, having them brush their teeth, take a bath. Okay, guidance during preschool years, family-centered care. You guys see that purple box? Okay. For the 3-year-old, encourage enrollment in preschool. Emphasize the importance of setting limits. Warn parents that the equilibrium of a 3-year-old child will change with aggressive, out-of-bounds behavior of a 4-year-old child. Let's go to 4 years old. For the 4-year-old, prepare parents for more aggressive behavior, including motor activity and offensive language, especially if they have older siblings. The thing is, they're listening and they pick up on things. And so if you have older siblings, the teenagers will be talking about certain things and they're hearing it and they'll want to act it out. Prepare parents for their child's increasing sexual curiosity. For the 5-year-old, make certain, put a star next to this, make certain that immunizations are up to date before the child enters school. Next page, under prevent spread, primary prevention. You guys know what primary prevention is. When it comes to primary prevention, and NCLEX is big on the 3 types of preventions, you guys better know them. Primary prevention, education, immunizations. Secondary prevention are diagnostic screenings, thank you, such as mammography, colonoscopy, right? Tertiary prevention, rehab, treatment, such as rehab, OT, PT, ST. Make sure you know the prevention. So especially when it comes to pediatrics, they're very big on primary prevention, on these, on parent education and immunizations. All right, table 33.3. Chickenpox, varicella. You need to know the agent, varicella zoster virus. How's it transmitted? Direct contact, droplet, airborne spread, contaminated objects. NCLEX. Period of communicability, also NCLEX. After the first crop of vesicles when crusts have formed. And this, guys, is when, after the crusts have formed, this is when they are no longer contagious. That is important because, and it's the same question every time, a different variation of it. Kids got varicella, parents concerned, they got to go to work. They want to know, when can the kid go back to school? They can't go back until the until the vesicles have crusted over. And that's when they're no longer contagious. Okay. Under prodromal stage, highly pruritic, they're going to be itching all over the place. Vesicles surrounded by erythematous base. By the way, when you see that word vesicle, not always, but most of the time it means of viral nature. So if you ever get a test question about vesicle, you have no clue what the answer is, choose one that's of viral nature. Like I said, there are exceptions to the rule, but I'm just saying, if you have no idea, choose something that's of a viral nature. Constitutional signs and symptoms, elevated temperature. Therapeutic management, antiviral agent, acyclovir for virus. Supportive measures. Diphenhydramine or antihistamines to relieve the itching, skincare to prevent secondary bacterial infection, which happens often. They're scratching themselves so much, they'll cause a break in the skin, and that's a perfect medium, perfect place for the bacteria to set in. Now the patient's got a secondary bacterial infection from the viral infection, okay? I did not see this, but for testing purposes, one of the things you're going to teach the parents is to put mittens on their hands to keep them from scratching and to keep their nails very short so they don't cut their skin. Okay. Under preventative, childhood immunization. Nursing care management, maintain standard airborne and contact precautions if hospitalized until all lesions are crusted, because until all lesions are crusted, they're still what? Contagious. You're going to keep the child in the home away from susceptible individuals until vesicles have dried. Excuse me. You're going to administer skincare, keep the child cool, lessen pruritus, keep them occupied so they don't focus on scratching themselves. Teach them to apply pressure to the pruritic areas rather than scratching. So instead of going like this, you can teach them to pat. Put a star next to this. NCLEX. Avoid use of aspirin. You guys learned that in pharm. What's aspirin associated with in children? Ray's syndrome. Very good. Next, diphtheria. Transmission, direct contact. Under clinical manifestations, for nasal, resembles a common cold. Resembles a common cold.
What does?
Diphtheria, the next one. Sore throat, low-grade fever. Lymphadenitis, possibly pronounced bull's neck in severe cases. Under laryngeal, fever, hoarseness, cough, with or without previous signs, symptoms. Therapeutic management, equine antitoxin, antibiotics, complete bed rest. Preventative, again, immunizations. Nursing care management, you're going to follow standard and droplet precautions. Have epinephrine available at the bedside. Administer complete care to maintain bed rest. Use suctioning as needed. Next, erythema infectiosum, known as fifth disease. And the way you remember this is the one that's a slap face. It takes 5 fingers to slap someone, right? Look at that kid's face. Look how red both of the cheeks are. Slap face. Fifth disease, 5 fingers to slap the face. That's how you remember. All right, transmission for fifth disease, respiratory secretions and blood products. Erythema on face, chiefly on the cheeks, slap face appearance. Now, right above the picture of the little girl, it says, in children with sickle cell disease or chronic red blood cell disorders, the rash is usually absent, and prodromal illness includes fever, myalgia, lethargy, nausea, vomiting, abdominal pain. And something I want you to recall, I don't think we talked about this, not recall, but keep in mind, children with the sickle cell disease, one of the things you're going to watch out for them is stroke. Because when you think of stroke, you kind of think of older adults, right? But the sickle cellers, no matter how old they are, you're going to be concerned of stroke. All right, symptomatic and supportive measurements, antipyretics for that fever, analgesics, anti-inflammatory drugs, possible blood transfusion for transient aplastic anemia, complications, self-limited arthritis and arthralgia, nursing care and management. Isolation of the child is not necessary except if they're hospitalized. Immunosuppressed, aplastic crises, suspected of paranovirus infection, they're placed on droplet precautions and standard precautions. Take a look at her face. Again, slap face. When you see slap face, you should be thinking of fifth disease. Next, roseola infantum. You guys there? Roseola. The agent is herpes virus. Clinical manifestations for roseola infantum. They'll have persistent high fever, higher than 103 for 3 to 7 days, and the child who appears well. Nursing care management, you're going to use standard precautions, give antipyretic drugs, and it wasn't on here, but shows up on tests, so you need to know it. Keep them hydrated, lots of fluids. Make sure you add that onto the nursing interventions. For roseola, herpes virus, fever 103 or higher for 3 to 7 days in the child who appears well. And then under nursing care management, you're going to use standard precautions, give them antipyretic drugs, and keep them hydrated. I don't know why they did this, but the picture below, this is the roseola, not mumps. I don't know why they put it under mumps, but just know that when you see this picture, it's not mumps. You guys see that, right? It's roseola. Okay. Next, let's talk about mumps. The source. You need to know the source for mumps. Saliva of infected persons. How's it transmitted? Direct contact with or droplets spread from an infected person. Prodromal stage, fever, headache, malaise, anorexia for 24 hours, followed by an earache that's aggravated by chewing. They're not going to want to eat. Pericarditis, by the 3rd day, the parotid glands enlarge and reaches maximum size. Symptomatic and supportive measurements. You're going to give them analgesics for pain and antipyretics for fever. IV fluids if needed for the child who refuses to drink or vomits because of meningoencephalitis. Nursing care management, you're going to maintain isolation during the period of communicability. Institute droplet and contact precautions during hospitalization. Encourage rest and decrease activity. Next, measles. Rubiola. Everyone there? Everyone there, measles? Okay. Transmission, usually by direct contact with droplets of infected persons. Clinical manifestations, rash. It appears 3 to 4 days after onset of prodromal stage. Constitutional signs and symptoms, anorexia, they're not going to want to eat, abdominal pain, malaise, generalized lymphadenopathy. Treatment, administer vitamin A. For children with acute illness, they're gonna get 200,000 IU. For children older than 12 months old, you really don't have to know the dose, but you need to know that vitamin A is what they're gonna get. Nursing care management. For the child with rubiola, you're gonna maintain isolation until the 5th day of the rash. If the child's hospitalized, you're gonna institute airborne precautions, encourage rest during prodromal stage, provide quiet activity, because remember, the job of the child is still play. For fever, instruct parents to administer antipyretics. Avoid chilling, because remember, chilling, that increases the metabolic rate of the child. If child is prone to seizures, institute seizure precautions. For eye care, you're gonna dim lights if photophobia is present. Paralyzer or cough, use cool mist vaporizer, protect skin around the nares with a layer of petroleum. Remember, petroleum is occlusive. Encourage fluids and soft bland foods. They're not going to want to choose. Skin care, keep the skin clean. Use tepid baths as necessary. And look at the difference of the first day of the rash and the 3rd day. Next, pertussis, whooping cough. For whooping cough, the transmission by direct contact or droplet spread from infected persons, indirect contact with freshly contaminated articles. So they got their nasty germs on the table that you just touched, and you put your hand in your mouth or your nose. Clinical manifestations, catarrhal stage, it begins with symptoms of upper respiratory tract infection, coughing, sneezing, runny nose. Paroxysmal stage, cough most commonly at night, consists of short, rapid cough followed by sudden inspiration associated with a high-pitched crowing sound or a whoop. During paroxysm, cheeks become flushed or cyanotic, eyes bulge, and the tongue protrudes. Preventative, again, immunization. Treatment, antimicrobial therapy such as erythromycin, clarithromycin, azithromycin. Supportive measures, increase oxygen intake and humidity. You want to loosen up those secretions. Adequate fluids. Nursing care management. Maintain isolation during catarrhal stage. If the child's hospitalized, you're going to institute standard and droplet precautions. Encourage oral fluids. Offer small amounts of fluids frequently. Provide humidified oxygen. Suction is needed. Encourage compliance with antibiotic therapy for household contacts. Use standard and droplet precautions in healthcare workers exposed to children with persistent cough and suction of pertussis. Something I did not notice on this table, but they do ask about this a lot when it comes to pertussis. Grandparents or caretakers who's going to be taking care of the child often, they need to be vaccinated as well. Let's go to rubella, German measles. Everyone there? Okay. The agent is rubella virus. Period of communicability 7 days before to about 5 days after the appearance of the rash. Constitutional signs and symptoms. Occasionally, a low-grade fever, headache, malaise, lymphadenopathy. Let's talk about this rash. It first appears on the face and rapidly spreads downward to the neck, arms, trunk, and legs. By end of first day, the body is covered with discrete pink-red maculopapular exanthema, disappears in the same order as it began, and is usually gone by the 3rd day. Preventative, surprise, surprise, immunizations. You're going to give antipyretics for the low-grade fever, analgesics for the discomfort. Nursing care management, patient's going to be on droplet precautions. Use comfort measures as necessary. Avoid contact with pregnant women. So guess what? If you're a nurse and you're pregnant, you cannot care for a patient with the German measles. I'm side-eyeing you. Scarlet fever.
That was German rebellion?
Yes, German measles, rubella, German measles. Now scarlet fever. The agent, group A beta hemolytic strep. How's it transmitted? Direct contact with infected person or droplet spread. Prodromal stage, abrupt high fever. Pulse increase out of proportion to the fever. Vomiting, headache, chills, malaise, abdominal pain. Halitosis, they're gonna have some stinky breath. Someone look this up for me. Ananthema, what does that mean? E-N-A-N-T-H-E-M-A. Ananthema. Someone looking that up for me, because I'm not. All right. Pharynx is edematous, a beefy red.
Eruptions, mucus surfaces.
An eruption of what?
Mucus surfaces.
An eruption of
Eruption.
eruption.
Mucus surface.
An eruption of mucus surface. An eruption of mucus surfaces. So click under images. What does that look like? This is what you guys are supposed to do when you're studying. When you come across something you haven't seen before, maybe you've seen it before, you just don't remember, you need to look it up. Oh, okay. Make sure you guys look at the image to see what that looks like. You won't forget it. The pharynx is edematous, is swollen, is beefy red. During the first 1 to 2 days, the tongue is coated and the papillae become red and swollen. White strawberry tongue.
It's a petechiae eruption.
White strawberry tongue. By the 4th or 5th day, the white coat sloughs off, leaving prominent papillae, red strawberry tongue, underline that red strawberry tongue. Usually when they ask about this, that's what you see. Palates covered with erythematous punctate lesions. Exanthema, rash appears within 12 hours after the prodromal signs. Red pinhead-sized punctate lesions rapidly become generalized, but are absent on the face, which becomes flushed with striking circummoral pallor. Therapeutic management, full course of penicillin. If they're allergic to penicillin, erythromycin. They can get oral cephalosporin. Supportive measures. Rest during febrile phase. Remember, we want to decrease that metabolic rate. Analgesics for sore throat, antipyretics for rash. Nursing care. Standard and droplet precautions until 24 hours after initiation of treatment. So they're going to have to be on droplet precautions until they've been on those antibiotics for a full 24 hours. Encourage rest during febrile stage. Provide quiet activity during convalescent period. Relieve discomfort of sore throat with analgesics, gargles, lozenges. Encourage fluids. Avoid irritating liquids. So this is not the time to give them things like orange juice or lemonade or anything that's going to irritate their throat. Avoid rough foods. Put a star next to this or highlight it. Discuss procedures for preventing spread of infection, such as discarding toothbrush because they're just going to reinfect themselves. Avoid sharing drinking and eating utensils. And then below you see the picture of that white strawberry tongue and then the red strawberry tongue. And you see what the rash looks like on the first day versus the 3rd day. Jump 2 pages, go to pinworms and enteriviasis, pinworms.
What was the official name? Something biases.
Entero, E-N-T-E-R-O-B-I-A-S-I-S. Everyone there? Pinworms? Guys, stay with me. We're almost done. No, not the box. It's actually text. We're almost done. Stay with me. Everyone there? Yeah. Okay. About 4 lines down. Pinworms. Transmission is favored in crowded conditions, such as classrooms and daycare centers. Infection begins when the eggs are ingested or inhaled. Look at this, guys. The eggs float in the air. Yes, very. The eggs hatch in the upper intestine, and then they mature, and then they migrate through the intestine. After mating, adult females migrate out of the anus and lay eggs. The movement of the worms on the skin and mucous membranes causes intense itching. As the child scratches, the eggs are deposited on the hands and underneath the fingernails. And you know how nasty kids are. The typical hand-to-mouth activity of young children makes them especially prone to reinfection. Pinworm eggs persist in the indoor environment for 2 to 3 weeks, contaminating anything that they contact, such as toilet seats, doorknobs, bed linens, underwear, and food. Except for the intense rectal itching associated with pinworms, the clinical manifestations are nonspecific. It's really that intense itching that really kind of clues us into, maybe this kid's got pinworms. Diagnostic evaluation. The tape test, make sure you know it. Tape. The tape test. Diagnosis is commonly made from the tape test. Repeated tests to collect eggs may be necessary. 3 consecutive days. Look when they do it, guys. That's important to know. Early in the morning before the child washes, and recommended for testing, because those pinworms like to go out and lay the eggs at nighttime. So you want to get them in the morning. You don't want to wake up the child. You want to get them in the morning before they wash up.
You can see them though if you I know like a pediatrician's office, you turn off the light and
they light up.
You can see the pinworms on the yeah.
You take the tape, and you know how the tape is sticky? You have the sticky type part on the outside. You roll that around your finger and you go like this because they'll stick to the tape. And then if you turn off the light, it's like they glow. You can see them. They're white.
Keep that.
Keep it?
Yeah.
Okay, therapeutic management. The drugs available for the treatment of pinworms include 1 to 2 doses of peritoneal pamoate, and I'm not gonna try. You see those drugs? Make sure you know them. I refuse. No, I don't. Pinrid, Antimeth. Okay, those are 2 drugs. Nursing care management. Parents need clear, detailed instructions for the tape test. A loop of transparent, not frosted. It can't be frosted. We got to be able to see it, right? Not frosted or magic tape, sticky on the outside, is placed around the end of a tongue depressor, which is then firmly pressed against the child's perianal area. Pinworm specimens are collected when? In the morning. In the morning, as soon as the child awakens, before the child has a bowel movement or bathes. The procedure may need to be performed 3 or more consecutive days before the eggs are collected. Parents are instructed to place the tongue blade in a jar or loosely in a plastic bag so it can be brought in for microscopic examination. Next paragraph. No, the paragraph after the next paragraph. To prevent reinfection, washing all clothes and bed linens in what type of water? Hot water. And vacuuming the house may be recommended. You're going to teach them about hand washing after toileting and before eating, keeping the child's fingernails short to minimize the chance of over collecting under the nails, dressing children in one-piece sleeping outfits. Oh my goodness, you see this one-piece sleeping outfit? Underline that, put a star next to that. I hadn't seen this one or heard of this one being on NCLEX. By the way, you guys know I don't write this exam. The only reason I kind of have an idea of what they ask about, my students who take it, they pass, they come back and they'll say, I saw this, and I'll see a common theme, right? But the last couple of NCLEXs, I can say that my students that have had like piece questions, this is on the one piece. So that's important. Dressing in one-piece outfits, daily showering rather than tub bathing. Inform families that recurrence is common. Treat repeated infections in the same manner as the first one. Take a look at box 33.2, clinical manifestations. Put a star next to this. Intense perianal itching is the principal symptom. Because all these other symptoms can be attributed to all other things, a whole bunch of other things, poor sleep, perianal dermatitis and excoriation secondary to itching. So number 1 is that itching.
The 1,000 is just to stop the kid from itching, or is it just to stop the
Limit amount of clothing, probably.
I don't know. That's a good question. I need to look it up because I said that the same time. At the same time I found out about it, I was like, oh, I gotta look it up, and I never did. I don't know. 2 pages. Talking with children who reveal abuse. Page 903, nursing care guidelines, talking with children who reveal abuse. You guys see that green box? Do not promise not to tell. Have you guys taken psych yet? Okay, same thing. In psych, you never promise a patient not to tell, same thing. Do not promise not to tell. You got to let child know that you're required by law to report certain things. Do not express shock or criticize the family. Because even though the mom or the dad may be the abuser, they still have a sense of loyalty. And if you say something disparaging about the mom or dad, they may not want to share anything up, and they may clam up, or they may take back what they said. Use their vocabulary to discuss body parts. So if they don't know the anatomical term, but they point to the vagina and they say, my cookie, you can say your cookie, your vagina, to let them know you know what they're talking about, but you have to speak in their terms, okay? Tell them that the abuse is not their fault. Box 33.4, warning signs of abuse. You guys all see that box? Okay. Child has physical evidence of abuse or neglect. Their history is incompatible with a pattern or degree of injury. The explanation of how the injury occurred is vague. The history is contradictory among caregivers. Bruising or other injury is present in a non-mobile patient. Put a star next to that one. You're not even 1 year old yet. You're 6 months old. So it's not like you were walking or running and you fell. So how'd you get this injury? Right? The patient has multiple fractures of differing ages. Next page, there are 2 nursing alerts. The first one on the bottom of the page. When children report potentially sexually abusive experiences, take their reports seriously, but also cautiously to avoid alarming the child or falsely accusing someone. The next nursing alert. Incompatibility between the history of the injury is probably the most important criteria on which to base the decision to report suspected abuse. Next page, another nursing alert. The priority is to remove the child from the abusive situation to prevent further injury. If there is abuse going on, the #1 priority is to remove that child from that situation. Next page, preventing and dealing with sexual abuse of children. That purple box, you guys see it? Pay careful attention to who is around children. Back up a child's right to say no. You need to teach it to the parents. Remind children that even nice people sometimes do mean things. Prepare children to deal with bribes, threats, and possible physical force. Teach children how to say no, ask for help, and control who touches them and how. If it ever becomes necessary to help a child recover from a sexual assault, listen carefully. Support the child for telling through praise, belief, sympathy, and lack of blame. You guys can read the rest on that. And that is the end of the chapter. Any questions?